let's now go through some of the nerve gliding exercises we can do that can start giving us some relief of our symptoms immediately. Remember, we want to keep that idea in mind that if the symptoms are traveling further down the leg, we're worsening it, we need to stop doing that. If the symptoms start to travel back up the leg and start to centralize, that is an improvement. Even if the pain here is still getting more intense, if the pain here is going away, we still look at that as a positive reaction. So what we want to do is we want to lay flat on our back. And I'm going to be treating my right leg. Right? So what I want to do is bring that right leg up towards my chest. I'm going to grab behind my leg and just hold it gently if I can. If I don't have this flexibility, I need to use a belt or a towel or a strap, that would be fine. All right? And now from this position, I'm going to keep my foot pulled back towards my shin. So I'm going to bend that foot back. And as I start to straighten that leg out, I'm going to feel that tension of the nerve. This should feel different than a muscle stretch, right? If you're having these sciatic symptoms, you're going to feel this nerve tension, that pins and needles discomfort, not so much a muscle stretch. Once I get to that tension, then I'm going to relax it, okay? So I want to go onto tension, off to tension, onto tension, off to tension. Now that nerve, we think about it running up the back of our leg, you can imagine as I get into this position, it's pulling it taut, right? And as I bend the knee, it's giving it a little bit of slack. So we can do that in a few different ways. Right now we're doing it by moving the knee. Right? This is kind of the easiest spot for people to start to learn this idea. But what we really want to progress to is where I get to this position and now I can change the tension by moving my ankle. Where right now as my foot's pulled back, I feel tension. As I point my foot, I feel release. Tension, release. Tension, release. Right? So I want to go back and forth with that. I think maybe 15 or 20 repetitions. It should be mild. You should not be excruciating when you do this. If you need to back off a little bit and you're doing it down here, that's fine. Our goal is tension on, tension off. It's not important how big your flexibility is. It's important that you get the reaction of tension on, tension off. So the ideal position when this nerve is on its longest stretch is that the hip is bent, right? The knee is straight and that foot is pulled back. Also, the leg should be across my body, so towards my left side, and rotated in. So I'm going to point my foot and rotate it in. That is where the nerve is its longest position, right? So I could possibly just work on this rotation back and forth, and that might be as I rotate in, tension on, rotate out, tension off, tension on, tension off. It could be as I bring my leg out to my same side, out to my right side, tension off. As I bring it across my body, tension on, tension off, tension on, okay? So ideally, as we start to move these different areas, we work it started from the knee, work from the ankle, we start working from the hip, and we're creating that tension. Now remember, that nerve is continuous with our spinal cord, which is continuous all the way up to our brain, right? So another way that I can start creating this tension is if I'm in this position and I'm right on the edge of my tension, as I pick my head up, and I want to do that first by tucking my chin, and that might create tension in my leg. And as I relax, that releases tension, right? Tension on, tension off, tension on, tension off. As I want to progress that, I can lift my head up, that creates more tension, and that releases it. Tension and releasing it, okay? So there's a variety of ways to do that, and we need to include all the mobility of the nerve, because if it's tacked in one spot, it's going to be restricting the other areas. So that's a good way that we can start to mobilize that nerve. As we get better at this, we can coordinate these things together. Think about that we're kind of playing a tug of war, pulling on one side or the other. So right now, I'm pulling towards creating that tension through my leg, and as I lower my leg down, I can create tension through my head. As I bring my leg back up and put my head down, right? So now I'm pulling back up towards I'm pulling the tension towards my foot, and now I'm pulling the tension from my head. Pulling the tension from my foot and from my head. And remember, that position is not just here, but across our body, rotated in, right? So I could be right here is my tension, and as I bring my leg away, I can pick my head back up. As I drop my head, I bring that tension from my leg, relax it on my head, and back and forth. Right? So there's kind of a combination of things you can do. If you understand this concept, you can apply it any which way. Right? It could be that right now I have tension, relax, tension, relax, tension. Okay? Same thing with the ankle, same thing with the hip. So there's a variety of ways we can do that. Find what works for you. You might have symptoms in your leg, but it might be coming from your neck. It might be coming from somewhere in your middle of your spine. So it's important that as we progress and get those symptoms under control, that we start to incorporate other areas, because the whole nervous system is connected, right? We can't address one area and not address the other. If we only address one area and we get the symptoms to go away, they're probably going to come back because there's still an area where that nerve is restricted in its mobility. Try those out, let me know how it goes.